Marfan Syndrome is a genetic disorder that affects the body's connective tissue. Connective tissue holds all of the body cells, organs, and tissue together. It also plays an important role in helping the body grow and develop properly. Marfan Syndrome affects the skeleton, eyes, heart, and blood vessel, nervous system, skin, and respiratory system. Connective tissues are made up of proteins. The proteins that play a role in Marfan syndrome is called fibrillin -1. Marfan syndrome is caused by a defect or mutation in chromosome 15. About 1 in 5,000 people have Marfan syndrome. About 3 out of 4 people have Marfan syndrome inherited. There is a 50% chance that a person with Marfan syndrome will pass along the genetic mutation each time they have a child. Marfan syndrome affects women, men, and children, and it has been found among many people of all races and ethnic groups. In the past, people who had Marfan syndrome rarely lived past 40. With regular monitoring and modern treatment, most people with Marfan syndrome can now expect to live a normal lifespan. Features of this disorder are most often found in the heart, blood vessel, bones, joints, and eyes. Some Marfan features, for example, aortic enlargement, expansion of the main blood vessel that carries blood away from the heart to the rest of the body, can be life-threatening. The lungs, skin, and nervous system may also be affected. Some symptoms that occur are enlargement of limbs, flat feet, long arms, legs, and fingers, a tall, thin build, curved spine, flexible joints, crowded teeth, hearing problems, collapsing lungs, vision problems, chest and ribs may stick in or out. Marfan syndrome can be challenging for doctors to diagnose because many connective tissue disorders have similar signs and symptoms. The diagnosis of Marfan syndrome includes looking at your family history, sometimes doing more genetic tests, and also looking to see if different parts of your body have any of the typical problems. Several tests are conducted to confirm, an heart test, an eye test, and genetic testing. There is no cure for the syndrome. Treatment focuses on preventing the various complications of the disease. There are different specialists you can go to meet: a heart specialist, an eye specialist, and a bone and joint specialist, also a genetic problem specialist. Medications often prescribed are blood pressure lowering drugs and beta blockers. Therapy is to correct your vision, which is glasses or contact lens, or surgical and other procedures. Depending on your signs and symptoms, procedures might include aortic repair, scoliosis treatment, breastbone corrections, and eye surgeries. Most people with Marfan syndrome can live relatively normal lives.